And diet, but that doesn't do the trick for everybody when it comes to losing weight, and that's where surgery can help.
A couple of weeks ago, we took a look at the ins and outs of bariatric weight loss surgery, but this time we're going to find out more about it from a patient who recently underwent the procedure. She's going to tell us how it can be beneficial, especially in a patient with diabetes. But things are changing. Bariatric surgery no longer just for celebrities or that person in the TV documentary who can't leave their house. Now it's for normal folks right here in West Michigan.
Dr. Oz called this the most underperformed operation in America today. If you think about it, only 1% of the population who qualifies for this surgery actually undergoes the operation.
Betsy is one of those people, and her reason for needing the surgery was similar to millions of others: overweight with type 2 diabetes.
I think that when you get to the point that you're ready to look at, is bariatric surgery right for me, then it's not scary, because it's like, this is a chance to change my life or to continue the way my life is. And the way my life was going was scary enough. I mean, just thinking about going blind or losing limbs or, you know, having so many complications you can have from diabetes, it just wasn't scary. It seemed like I was excited. Like, when can we do it? When can I have it? I really couldn't wait.
She just had the procedure in January and looks great. Betsy had the sleeve gastrectomy, which reduced the size of her stomach. Now she exercises more and eats less.
It's crazy how much you think you have to eat to function, but then when you physically can't, you're like, wow, I can't believe how much I would put in my mouth before and didn't think twice about it, you know. So that has been a huge lifestyle change for our whole family. It's really affected everyone in a positive way.
The results really were immediate. Betsy says she's a lot more active now and is able to play with her kids.
You know, before it was like I was just tired all the time and I would watch them play, where now it's like I get on the floor and play with my daughter and we do things. We go outside and do activities we haven't done in a long time, and just having the energy to want to go do things has been a huge lifestyle change.
Oh yeah, and that diabetes problem?
I recently went to an endocrinologist for my diabetes, and he just looked at me and he said, well, you're a strange lady, because I don't know what you are right now. He said, I don't know if you're diabetic, I don't know if you're not. He said, clearly you're not a type 1 diabetic, because I've gone a few days now even without taking any insulin. And he said, you would be in the hospital or dead if you needed insulin. So he said, you know, your diabetes is changing. He said, I really don't know what to label you right now, but he said, whatever you're doing, keep it up, it's working.
Wow, that's great.
Good news there.
Healthy,
and
yeah.
Dr. Schram says if you have the procedure, it'll take about 3 years to pay it off with the insurance coverage. And as Betsy said, the amount she was spending on diabetes supplies equals just about what it costs to do the surgery. Yeah. So it's one of those things, kind of like getting your hip replaced. Oh, I wish I would have had that done sooner.
Yeah, can't put a price on health.
Yeah.
Good for her.
Don't forget, you can catch all of our past medical moments online.
Just head to fox17online.com. You can find the medical moment tab under the news link there. And we still have a lot more ahead tonight at 5 o'clock. Despite the tulips blooming early,